Good morning, everyone. Myself, Dr. Trisha Ghosh. Today, I'm going to present on the topic, Role of Blood Cells Associated Inflammatory Indices in Early Screening of Diabetic Retinopathy. According to WHO, diabetic retinopathy accounts for 4.8% of the number of cases of blindness globally. A study conducted by the Union Health Ministry in collaboration with AIMS revealed the prevalence of diabetic retinopathy in India to be 16.9%. The angiogenic, inflammatory, and oxidative stress pathways play an important role in the pathophysiology of diabetic retinopathy. Since the neutrophils mostly adhere to the endovascular endothelium in DR, the determination of neutrophil to lymphocyte ratio might reveal enhanced microvascular inflammation in DR patients. On the other hand, platelet stickiness occurs in occluded blood vessels, its size increases, releases more thromboxane A2 and beta thromboglobulin, leading to accelerated thrombosis. Therefore, the measurement of the mean platelet volume and platelet to lymphocyte ratio might provide a diagnostic indicator of diabetic retinopathy. The aim is to study the role of inflammation in the pathogenesis of DR. The objectives are to evaluate the relationships between DR and platelet to lymphocyte ratio, neutrophil to lymphocyte ratio, and mean platelet volume, and to compare these values between DR and non-DR subjects. It was a cross-sectional study conducted over patients attending the ophthalmology OPD of a tertiary care hospital. Patients with definitive diagnosis of type 2 DM were screened for DR and were divided into DR and non-DR group. And the blood samples obtained from these patients were analyzed. Patients with family history of hypertension and diabetes, type 1 DM, severe systemic disease, glaucoma, trauma, pregnancy, malignant tumors, cardiovascular and cerebrovascular diseases, liver and kidney dysfunction, recent surgery, infection, severe stress, and smokers were excluded from my study. Finally, we enrolled 30 patients in the DR group and 30 patients in the non-DR group, and the mean age distribution of these patients varied from 50 to 60 years of age. This bar diagram shows that the mean neutrophil count in the DR group was higher than that of the non-DR group, whereas the mean lymphocyte count in the DR group was lower than that of the non-DR group. This line diagram shows that both the mean platelet volume and the platelet values were higher in the DR group than the non-DR group. Finally, we calculated the neutrophil to lymphocyte ratio and platelet to lymphocyte ratio and found that both these values were higher in the DR group than the non-DR group. A recent hematoanalysis conducted by G et al. Indicated that MPV values were significantly more in the DR group in comparison with healthy controls and in diabetic group without retinopathy. Liu et al. Indicated that MPV and NLRR values were more in patients with DR than in type 2 DM patients without DR. Liu et al. Showed, as compared with type 2 DM patients without DR, the values of MPV, NLR, and PLR were much higher in patients with DR. In our study, the association of mean platelet volume, neutrophil to lymphocyte ratio, and platelet to lymphocyte ratio with that of diabetic retinopathy was investigated. And we found that the DR group has significantly higher MPV, NLR, and PLR values as compared with the non-DR group. Thus, routine blood examination could provide effective information to assess risk stratification of the disease and early screening of diabetic retinopathy. These are my references. Thank you for your kind attention.
So, how you have? There are many other systemic conditions which can, associated with diabetic, which can give this marker raise or inflammatory mediator increase. So,
history of the patient. Only by taking history of the patient.
Many times patients may not be aware that he has so many other systemic conditions. It can't be very generalized marker.
Yeah, but actually we just asked the patients that whether he had any previous diseases or not.
Okay, sure.
Will it have any therapeutic implication, your study?
Sorry, I can't.
Therapeutic implication does it have?
Therapeutic.
I mean, what sir wants to say is that how do you kind of this data? How do you kind of correlate with the current management protocols or the assessing the disease?
For early diagnosis, so that it does not progress. We can diagnose.
No, but then you can just do a simple blood sugar test and diagnose. No, why do you want to go in for these parameters?
But all patients with diabetes does not have diabetic retinopathy, so that's why we are.
So you basically need so that is what we want to know. So you're basically trying to say that people who have these parameters high have higher incidence of diabetic
Yes,
retinopathy.
yes.
But the cases that you took, were they newly diagnosed diabetics or were they known diabetics
No, they were known diabetic patients.
with a certain
With,
years of diabetes?
yeah, for 10 to 11 years of diabetes.
So that's also a long-term diabetic. No? Right. Thank you.
Thank you. So I